Yes, Representative Lofgren, thank you for being here. You said that those who are covered now by medical plans will not be affected by this. But people on Medicare are already, the doctors are already cut substantially, as are hospitals. And as I understand this plan, there's supposed to be further cuts to Medicare providers, including hospitals. Now, already it is very difficult to find a doctor who will accept Medicare patients. And hospitals are really suffering from their lack of income that is cut by current policies. So I can't imagine how further cuts are going to help us, and Medicare patients are really going to be affected.
The reimbursement rate for physicians in Medicare is too low. And in fact, when we adopted the pay-as-you-go statute, we excluded the fix for that. Maybe we were trying to give ourselves a little bit of a break on it, because that preceded this current crisis. And there is going to be an adjustment on that so that Medicare physician providers can be compensated adequately. I'm aware of that. What you say is true. Now, there are, nevertheless, some areas where cost savings can occur. And here are some of the main ones. The Medicare Advantage I've mentioned earlier, with the caveat that the nonprofits that are not milking the system, we need to make sure that they are not disadvantaged. If you take a look at the duplicity of tests that seem to rise whenever the equipment is owned by physician-run entities, they're through the roof. And so what we want to do is to incent through payments the consolidation of treatment oriented towards the patient instead of by procedure. And in fact, just as an example, and you'll see this in the summary, the number after a Medicare patient is hospitalized, the amount of readmissions is over 50%. And the medical experts tell us that a substantial portion, at least 40, maybe up to 50% of those readmissions are preventable had the right thing been done with that patient to avoid the readmission. And so the incentive is for physician teams to do what is necessary for that patient to be able to go home as a healed patient instead of to be readmitted to the hospital. And most of the people I know on Medicare would much prefer that outcome than an unnecessary readmission.
You know, there's probably one thing that most of us can agree on, whether we're for the health care bill or against the health care bill. One of the things we don't like is more big government. Every time there's things happening in Washington, and you guys focus on developing more and more big government, we get the shaft for it. I mean, you guys can't deal with Social Security right now. You can't deal with Medicare right now. It's trillions and trillions of dollars in the hole. You guys can't even make that solvent. Why don't you guys focus on doing that first, taking care of the 8 to 10
there are differences of opinion in this room, and that's the American way. I am not one who believes that there is no role for government in American life.
I'm not saying that.
You may disagree, but when my late father was ill for a number of years, he had Medicare, a big government program. And it really provided the kind of medical assistance that he needed. I was grateful as a daughter that he had the quality of medical care that he was able to get.
Why don't you take care of him?
Don't change it.
So often, my name is Georgia Lofgren. I have called your office numerous times. I emailed the White House. I call my senators. The reason these people are so upset is that we call our representatives, and when they answer the phone, not you, but the 20-year-olds, we give our concerns, they hang up the phone, or we email. You never hear from us. You never get back to us. It is like when I see you here, it's like a piece of candy being dangled in front of me, and it makes me angry that you are not listening to me. People want to be heard. And to say, and I know we're a guest here, sir, but to say you're going to close us down because these people want to be heard. We voted you in. We
can vote you out.
And we have to work extra hard because of Acorn, ladies and gentlemen.
I think some of you have noticed that the emails I now receive are from my website, and there's a reason why I had to make that change with a great deal of regret. I was getting 75,000 to 80,000 emails a day from all over the world, to the point where we couldn't even sort through 80,000 emails a day. And so now I do something which is, I well understand that I work for the people who live in the 16th Congressional District. They send me emails when the calls are made. I get a summary of the calls made. I can't say I see every email the day it comes in, but I see all of the emails and letters that come in. The fact is that people disagree in this district and in this country about what should happen. And I can't tell you, obviously many people here are opposed to the role of the federal government. Don't like this. That's right. But I have been to many other forums where the citizens who are speaking have given me quite a different message. So
Not recently.
With as much courtesy as I can muster, and hoping for a little more from you, so that we can have an exchange of views in true American spirit.
Okay, good. I'm not a rock star. Anyway, you mentioned a few minutes ago that none of the illegal aliens, would be covered. I have here a summary of the program, of the entire plan, and it states on page 50 and 51 that all non-U.S. citizens will be covered under your plan.
What do you say now?
Either you are misinformed or you're mischaracterizing.
Just lying.
If I can respond, I don't know the summary, but there is a sentence, and I can't remember the exact place in the bill.
Really?
But I will post it on my website tomorrow with the citation that specifically prohibits the participation of illegal aliens in this country.
They already participate
At
today.
this point, we agreed earlier that our
Ridiculous.